time could be ticking on Obamacare. Vice President-elect Pence saying that the Trump administration will work on repealing and replacing the health care law right out of the gate. That probably can't come soon enough for people looking at an average premium hike of 25% under Obamacare, less choice, insurers disappearing. Betsy McCory is here, author of the book Beating Obamacare, and you're smiling.
I am smiling. It's taken 6 years, but yes, this law is headed to the paper shredder.
How in the heck did Democrats, who President Obama shoved it down, we were talking about tax reform, shoved that down people's throats? He didn't get people on board. How did they think that was going to work? How did they think it was going to work?
Well, clearly it hasn't worked. About 200 million people are being hurt by this law. 200 million. You take the 155 million people who have on-the-job coverage, you've seen their deductibles go up 49% since this law went into effect. Then you've got 11 million people incurring huge penalties because they didn't sign up for Obamacare. Then you've got 55 million seniors who are being hurt in their wallets and also getting skimpy care in the hospital because cuts to Medicare pay for over half this law. And finally, you've got people who are part-time workers and saw their hours cut so that employers could evade the impact of the employer mandate.
About the premium
over 200 million people.
People have had to change insurers repeatedly because the insurers have left a lot of these markets in the exchanges. You've had people who have less doctor choice. Some doctors don't even take insurance anymore. But in terms of the repeal and replace, what do you start with? Because you have 20 million people who have gotten health insurance under this law. So are 20 million people going to lose it?
No. And that is the myth that unfortunately is scaring so many people in the country. Of the 20 million people who gained coverage for the first time under this law, 16 million are enrolled in Medicaid, the public program for low-income residents. Certain states expanded Medicaid and welcomed these 16 million people in, and no matter when this law is repealed, those states are not going to do a 180 and throw those people off the roll. Those 16 million people are safe. That leaves 5 million additional people who gained coverage. They're enrolled in Obamacare plans, private health plans, and they are technically at risk. 5 million, not 20 million. But even those 5 million have something to gain from repeal because Donald Trump's plan, for example, will help most of them get much more affordable coverage.
How?
Those 5 million people.
Because these people are getting subsidies. I'm assuming that the subsidies are going to go away. So you give them a refundable tax credit, for example?
But here's the problem. They're getting a subsidy, and technically they're covered, but they still can't see a doctor, Daegan, because even the cheapest plan, the bronze plan, has a $6,000 deductible. They can't cobble together the cash to see a doctor.
Well, how do the pre-existing conditions clause?
That's the most important.
Do you keep it if you're in the Trump administration?
The people with pre-existing conditions will be protected, but in a much fairer way. The Obama health law does it in a very coercive way. It takes healthy people in the individual market, it's only a small number of them, and forces them into the same insurance pool with chronically ill people who need 10 times as much health care.
And
says to these healthy people, you have to pay the same price. So none of their premium ever goes to cover their health care needs. All of it is sucked up to care for the chronically ill. Under the replacement plans, chronically ill people are sold insurance. Insurance companies are allowed to charge them more, but then those people get a big subsidy from the taxpayers. The cost of their care is spread over the entire nation instead of being dumped on a very small number of people in the individual market. You're going to see individual premiums and deductibles go way down when this change occurs.
Good to see you on Thanksgiving, Betsy.
Thank you.
And one thing we can say for sure, that thing's changing. So start tearing pages out of it.
Goodbye, Obamacare.
Just throw the whole thing away. We'll see actually how that gets done, Betsy.
And thanks to President-elect Trump, because he finally is going to do it.
Yep. Thank you, Betsy.